Hello, my name is Dr. Natalie Kwit. I'm the State Public Health Veterinarian for the Vermont Department of Health, and this webinar is called Rabies and Animal Bites, Roles and Responsibilities of Town Health Officers. I originally gave this webinar in May of 2019. It was a Vermont League of Cities and Towns hosted webinar, but I've since then updated and I'm recording this now for viewing in future. So today's objectives will be to provide a brief overview of rabies virus and how it's transmitted, discuss the clinical manifestations of rabies in both humans and animals, describe the epizootiology or patterns of rabies in animals in Vermont based on our testing and submission data, and review town health officer responsibilities and procedures regarding animal bites and rabies straight from policy documents such as the communicable diseases rule. So rabies is a fatal viral disease that affects humans and other mammals. Survival is rare. There are less than 10 documented cases of human survival from clinical rabies. It is caused by a group of RNA viruses in the family Rhabdiviridae, genus Lyssavirus. Rabies is historically significant and much feared prior to the development of control measures that we have today. And the virus is present in the saliva of clinically ill animals. There are some animals that are more likely to be infected and transmit the virus than others, and the only hosts are mammals, not birds or reptiles. Rabies is primarily transmitted through bites, causing introduction of infected saliva into open wounds. Non-bite exposures are extremely rare, but possible if infective saliva or neurologic tissue, such as brain or spinal cord, enters the bloodstream into open cuts or mucous membranes of the mouth, nose, or eyes. Organ transplantation is the most common route of non-bite exposure in humans. Infection via virus inhalation is possible if neurologic tissue is aerosolized, especially in laboratory environments. Virus is not present in blood, urine, feces, or skunk spray, so these bodily fluids of animals are not infectious. Also, you cannot get rabies by what we call secondary exposure by touching things that may have saliva on it, such as a water bowl or a pet's fur that had contact with a wild animal. Globally, 99% of human cases of rabies result from dog bites, and an estimated 59,000 people die each year from rabies. And 4 out of every 10 deaths are in children. The highest incidence and mortality due to rabies is in India. While dog rabies is the most common rabies variant worldwide, in the United States, multiple rabies virus variants are maintained in wild mammalian reservoir populations such as raccoons, skunks, foxes, and bats. And as you can see by this map, raccoon variant rabies predominates in the eastern United States, including Vermont. But bat rabies is found everywhere in the continental United States because they can fly. In the United States in 1938, most cases of rabid animals were domestic species and some were wild. But since then, the numbers have reversed. Once the leading cause of human rabies deaths in the United States, dogs are no longer as much of a risk thanks to the use of rabies vaccines. Dogs are only 1% of rabid animals reported each year in the US today. In the United States, the occurrence of rabies among dogs is rare and sporadic, largely as a result of widespread canine vaccination and animal control programs. And since 2004, dog-to-dog rabies transmission has officially been considered eliminated in the United States. This means that dogs only function as incidental hosts to the rabies virus, much like humans do. In Vermont, 5 cases of dog rabies have been reported since 1992, and the most recent occurring in 2013, and this dog was imported into the state. Although cats do not maintain the virus's reservoirs like dogs, cats are reported rabid more often than any other domesticated animal in the United States. Stray cat populations are particularly vulnerable because of their low vaccination rates and frequent encounters with wildlife. In the United States, rabid cats are most common in places where rabid raccoons are common. So that includes along the eastern seaboard. And in Vermont, during 2005 through 2019, 1.4% of cats submitted for testing at the Vermont Department of Health lab were rabid, and that's 11 cats total. And the most recent was in 2018 in the town of Charlotte. Each year, 1 to 3 human rabies cases are reported in the United States. This chart shows the 56 total human cases in the United States residents during 1990 through 2018. Of these, 44 were acquired in the United States. The others were acquired through international travel. And those that were acquired in the United States, only 2 were due to dog rabies and 4 from raccoon rabies. And these are shown in the purpley maroon bars. However, most domestically acquired cases, 42 total, were acquired from bats, and these are shown in the blue bars. So bats pose the highest risk to humans in the US as far as transmitting rabies. Early symptoms of rabies in both humans and animals are often nonspecific and include fever, malaise, or lethargy, and headache for humans. Also signs of vomiting and anorexia or not eating in animals. As the disease progresses, humans have reported tingling and numbness near the exposure site, which then progresses to altered mental status, anxiety when presented with water, difficulty swallowing, and muscle spasms. And illness progression is rapid. Once clinical signs begin, death occurs 2 to 10 days later for humans and within 7 to 10 days for animals. There is some variation in how animals act when rabid. For example, cows display an abnormal vocalization called bellowing. Horses particularly have trouble swallowing called dysphagia. Cats get an acute hind limb paralysis. And foxes are, in my experience in Vermont, are particularly aggressive and responsive to noise. It takes several days up to several months for the rabies virus to incubate in the animal, that is, to travel from the site of the bite or exposure or entry into the animal of the virus to the brain and into the saliva, at which that point the animal becomes infectious. Once infectious, an animal generally dies within days, which is why an animal, cats and dogs in particular, are observed for 10 days after biting a human to make sure it stays alive and healthy. And in that way, we know it was not shedding rabies virus at the time of biting a human. So let's move to a cat model to describe the pathogenesis of rabies. A rabid animal bites the cat victim, introducing virus from the saliva into the muscle tissue. And here it's in the back left, the left hind leg of this cat. Virus grows in the muscle tissue in the area of the bite. Virus infects the sensory and motor nerves serving the infected muscle. Virus travels from the peripheral nerves to the central nervous system, and the central nervous system being the spinal cord and brain. And virus migrates throughout the central nervous system, here starting in the spinal cord, and then arrives at the brain. And this is the end of the incubation period. Virus is then conducted by nerves into the salivary glands, where it grows and is shed through saliva. And at this point, the animal shows clinical signs of rabies, and this is the only time the animal is infectious. and death occurs within 10 days of showing clinical illness and becoming infectious. So this is a summary table of rabies cases detected in Vermont wildlife and domestic animals from 2005 through 2018. And this list is arranged from highest to lowest frequency of positives. Raccoons, not surprisingly, being the most common species infected, as this is the circulating variant, host-adapted variant in the eastern United States, followed by skunks, bats, and gray foxes. And I should note that all of these types of animals are also infected with the raccoon rabies variant in Vermont. And this is just another way of showing which animals have tested positive for rabies in Vermont since 2006, from highest to lowest again. Raccoons most frequently test positive, followed by skunks, bats, then foxes. And the most common domestic animal to test positive for rabies in Vermont were cows, followed by cats, while nationally cats test positive more frequently. So it's very Vermont of us. This chart shows the total number of rabies tests performed at the health department laboratory since 2006. While the submissions have gone up, largely due to enhanced rabies surveillance in recent years, since 2016, the total positive in blue have gone down. And here are just the total positives over time, which you can see a little bit more clearly have decreased in more recent years. And this graph shows the total rabies submissions for test submissions by month during 2006 through 2019. As you can see, we get more submissions during the summer months when wildlife are more active. However, this graph just shows positive by month of the year for the same time period. Rabies is still found throughout the year, even though we get more submissions in the summer. And the total positive by month during this time period didn't fluctuate too much depending on the season, although we do get a slight increase in the summer months. Geographically, rabies has been found throughout the state. The towns on this map shaded in green show the number of total animals submitted for testing during 2005 through 2018, and the highest number of submissions are in darkest green. The purple dots show only those animals from that town that were positive. So a lot of testing occurs in higher population density areas such as Burlington and surrounding Chittenden County, and in the northern part of the state, largely due to enhanced rabies surveillance done by USDA Wildlife Services. Also, largely due to rabies vaccine bait drop led by the USDA Wildlife Services, we're finding fewer terrestrial mammals testing positive from the northern part of the state, which is within the bait drop zone. And this map shows a recent year of data into 2018. So you can see we have more of those purple dots or rabies positives from the southern part of the state. And those that are in the northern part of the state were mostly bats, and that's because they are not targeted by the USDA rabies vaccine bait drop. So when to test? In Vermont, we prioritize and test animal specimens for several reasons. And the highest priority reason is for possible human exposures to help decide if post-exposure prophylaxis treatment or rabies shots is necessary in that human. Other reasons include testing animals that may have exposed domestic pets or livestock to rabies, testing animals for diagnostic purposes, and these are usually requested by veterinarians based on a clinical suspicion of rabies, and lastly, through surveillance. One example of surveillance testing is the Enhanced Rabies Surveillance Program coordinated by USDA Wildlife Services, which I've already mentioned. And this is done to tell if wildlife vaccination efforts via the rabies bait drop is effective in preventing rabies in wildlife. And this figure summarizes rabies positives or total tests by test reason during 2006 through 2019. And by far, animals submitted for testing because of contact with domestic animals or pets had the highest proportion positive. And this is not surprising because domestic animals spend a lot of time outdoors and may be attacked or exposed to wild animals before their human counterparts are. And this also highlights the importance of domestic animal vaccination. So by law, all cats, dogs, and ferrets in Vermont must receive regular rabies shots starting at 4 months of age. And owners of all domestic dogs and wolf hybrids more than 6 months of age must license the animal at their town clerk's office. And animals must be vaccinated to be licensed. So this helps enforce rabies vaccination in these pets. When a human is bitten by a dog, cat, or ferret, rabies virus exposure can be ruled out in 2 ways. Healthy animals that bite humans should be confined and observed for 10 days, regardless of their rabies vaccination status. And if the animal remains alive and well after this monitoring period, the bitten person was not exposed to the rabies virus. Animal testing is only indicated if the quarantined animal shows illness or neurologic signs that suggest they might be ill with rabies. And the animal has to be euthanized to be tested. And these decisions should only be made in consultation with a veterinarian. And the veterinarian can consult with me or others in my group here at the health department. Per Vermont's communicable diseases regulations, physicians or healthcare providers shall report to the local health office the full name, age, and address of any person known to have been bitten by an animal of a species subject to rabies, and that includes all mammals, within 24 hours of actual or constructive notice. If there's no doctor in attendance and the person bitten is an adult, that person shall report or cause to be reported such information to the local health officer. And if the person bitten is under 18 years of age, the parent or guardian can make that report. Whenever an animal subject to rabies, again, all mammals, but there are certain animals that are brought to veterinarians. If they're brought to veterinarian to be euthanized, an attempt shall be made by the vet to make sure that the animal has not bitten any person within the previous 10-day period. And before euthanizing the animal, they shall require the owner to sign a statement to this effect that they had, the animal had not bitten anyone, and they shall not destroy any animal which has bitten a person within 10 days. And the health officer must be notified by the veterinarian of any such biting incident that they find out via this route. If the biting animal has to be euthanized or is euthanized within 10 days of biting a human, the vet shall consult with the health department, and it's usually recommended that they submit the animal for rabies testing because that is the only way we can rule out rabies shedding or rabies virus exposure in that human bite victim. So once a town health officer receives notification that an animal has bitten a human, they should contact the bite victim and animal owner, of course only for domestic animals, to get more information. Then complete the animal bite report form with this information, including animal type, animal's rabies vaccination status, and circumstances of the bite. Again, just to record the rabies vaccination status is good to know more for town licensing information, but the 10-day monitoring period is required no matter the animal's vaccination status. So if they're up to date or not up to date. The local health officer shall cause an apparently healthy dog, cat, or ferret, regardless of vaccination status, that bites a person to be confined and observed for 10 days. And this may be carried out at the residence of a responsible animal owner. And the animal must be under the control of the owner at all times and should not be running loose or be exposed to numerous individuals or children. If the health officer feels that the owner will not be able to confine the animal appropriately, it can be confined in a facility at the owner's expense, a facility being either a vet clinic or a boarding facility. If the animal is a stray, it can be confined at a town's facility or an animal shelter. And during the 10 days, it is the responsibility of the town health officer to check on the health of the animal. And at the end of the 10 days, the town health officer needs to verify that the animal is alive and call the victim with that information so they know they don't have to proceed with any rabies shots or other actions. 10-day observation is used to rule out rabies virus shedding at the time of biting a human, but it should not be used to assess whether that particular animal is infected or incubating the virus. Like humans, a dog can incubate virus for weeks to months before showing signs of the disease. To rule out rabies infection in an unvaccinated dog or cat that possibly had been exposed to rabies virus, the animal should be immediately vaccinated and confined and observed for 4 to 6 months, or euthanized after consultation with the health department. For currently vaccinated and or those dogs, cats, ferrets who had ever had a vaccine, the animal should be immediately revaccinated and then just observed for 45 days. And decisions on quarantine and vaccination in post-exposure vaccination animals, domestic pets particularly, possibly exposed to rabies, should always be made in consultation with the health department, and usually involving the animal's veterinarian. Any animal that dies during a 10-day bite confinement or is otherwise suspected of having rabies should be submitted to the health department laboratory for rabies testing. And this is usually done by a veterinarian, but the health officer may be requested to assist in this process in some scenarios, more so I would think for wild animals or stray animals. There is no charge for testing, but the animal owner is responsible for any veterinarian fees. And if the animal is a stray, any veterinarian fees are the responsibility of the town or animal shelter. The Rabies Hotline or health department should always be notified before submitting or consulted with before submitting any specimens for rabies testing. In animals, testing is performed post-mortem only, as I mentioned, because it requires brain specimens, preferably 2 sections, including brain stem and cerebellum or hippocampus. And these are stained with a fluorescently labeled anti-rabies antibody. If rabies virus is present, it will light up when viewed under a fluorescence microscope, like in this photo. And if this was a negative test, the photo would be completely black.
A confined animal being observed for signs of rabies shall not be removed from one health district into another prior to the conclusion of the prescribed 10-day observation period. If movement is necessary, for example, the owner is moving or the pet needs medical care, an animal may only be moved after seeking permission of the health officer to whose jurisdiction the animal is to be transferred. If the destination is another state, the originating jurisdiction health officer may only give permission to the owner after securing the approval of the Vermont Department of Health. Please call this number to request permission. 863-7240, option 7. We will ask for more information about the animal and the owner's information to share with the destination state health department for their approval. Such movement shall only be done by a responsible person and conducted in a manner to prevent the escape of the animal or its coming into contact with other animals or persons.
As no 2 situations are the same, it is important to seek guidance with any scenario. We have a cooperative services agreement with USDA to maintain a rabies hotline, and they can be reached during business hours for any rabies-related and wildlife matters, even including those situations involving domestic pets. And the health department may also be contacted for human and pet post-exposure risk assessments, management of animals that bite humans, and for approval of animal testing. We can also be contacted by town health officers after hours and weekends if needed. We talk so much about what to do after a dog or cat bite that I don't want to forget that prevention is really key. And here are just some resources that you can consult to help with dog bite prevention in your community. The first is a new resource that the Vermont Veterinary Medical Association has put together. It's called the Dog Bite Prevention Program. And through this program, schools can request dog bite prevention presentations for children given by Vermont veterinarians. The second resource is the CDC Dog Bite Prevention webpage, including information on how to prevent dog bites. And the third is the National Association of State Public Health Vets Compendium of Measures to Prevent Disease Associated with Animals in Public Settings. There are sections of this document focusing on animal bite prevention. I also highly recommend visiting our rabies webpage at healthvermont.gov to review recent rabies testing data, frequently asked questions, forms, exposure, our animal management algorithms, and the Vermont Rabies Control Resource Manual. Thank you for your time.